Good morning, everyone. Am I audible now? Good morning, everyone. Warm welcome this morning as I present my work in the field of mistletoe, romance, and the kiss of life. I truly consider myself blessed to have been chosen to work in this field. And I want to take you back the journey, the life journey and the healing journey which made me enter the world of mistletoe. And this was way back in 1990 when I was working in mid-Mumbai with a doctor who was trained in the Lucas Clinic in Switzerland, and he used to prescribe Iscador on a letterhead. And I saw several patients improve not in a microscopic way for only the tumor size and arresting tumor growth, etc., but improve in their quality of life, in their sense of being, in their salutogenetic way of living. I think we discussed about salutogenesis by Dr. Henning Saup yesterday, and the overall holistic well-being of those patients. And I was observing them, so I asked him one morning, I remember around 10:30 in the morning, I said, "Sir, what is this that you are prescribing?" 1990. And he said, "Zubin, this is mistletoe. This is mistletoe." And thanks, Carla. So this is mistletoe. And I said, when I looked up mistletoe at that time, I was just graduated from university. And he said, "Do you want to study it?" I said, "Yes." He said, "Okay." Then he gave me the address of the clinic in Allesheim, CH 4144, Brachmattstrasse 19, Allesheim, Switzerland. And I wrote to them, and I began my journey at that time in 1991. And I attended the seminar on anthroposophy to make my principles of anthroposophy, the main science behind mistletoe, discovered by Rudolf Steiner. And then I attended the seminar. I came back to India. And since then, in 1991, since then, I've been using mistletoe for treating cancer patients, and it's been a wonderful journey. In 1994, my desire to seek more knowledge and to work with European oncologists took me back to the Lucas Clinic, wherein I worked in the clinic to see the subcutaneous use of mistletoe, the intravenous use of mistletoe, the intratumoral use of mistletoe, and that's how my journey began. So it's been 32 years of my life that I have worked on this plant, along with my main medical graduation at the Homeopathic Medical University. So I'm primarily a trained homeopathic physician, wherein we treat various ailments at the Medical University outpatient department and my practice in India, in Mumbai. And we see every Tuesday we go to the university and we see around 20 patients over about 5 to 6 hours, common ailments, and some of them cancer patients. So I welcome you to my presentation, Mistletoe, the Kiss of Life. In fact, on a very funny note, I was Googling, and I always start many of my presentations with a short story. And I was Googling about the kiss. What happens when you kiss someone? And in one of the internet sites, it said that you transmit 80 million bacteria from partner to partner when you kiss your partner. And that kind of peps up the immune system because you are transferring bacteria each time you kiss. In fact, the site mentioned it's a bit like the immune system having a foreplay. Okay, so I'll be talking about the mistletoe throughout the next 45 minutes, a bit of history, a bit of pharmacology, some cases, and what is the perspective of mistletoe in oncology, with a shade of how medicine has to be practiced. In fact, 50 years ago, when we didn't have scans, MRIs, CT scans, what was the clinical set and the clinical skill of a doctor, of the age-old family doctor? Remember, we used to have a family doctor who used to go to, who used to understand the whole family. Father, mother, son, daughter, partner, uncle, aunt. Sadly, the first step of contact with a doctor who spends time with you, who understands your journey, has been lost. Because in today's world, we all go to specialists. We all are highly educated and we want highly educated doctors. We want DNBs, we want MDs, we want internal medicine doctors. But I've always believed and I've always practiced in Mumbai at my clinic, it is the family doctor that's the first step of contact to whom you go and say, I got a bad throat, I got a bad eye, I got a sty in my eye, I got a pharyngitis. And he listens to you, he listens to your journey of an acute ailment, whether it's a bad throat or a tonsillitis or an asthma. And then he gives you time. He gives you time. And my goodness, time is always short in the medical world. I see so many times, even in Mumbai, we have patients who go to super specialty hospitals spending on an average 3 to 5 minutes by the consultant. And one of the stories I was sharing with the patients I consulted was something very, very unique. I had an ovarian cancer patient that I'm going to present today, the 4th case today. And when she came to me in my clinic, her name is Sanjukta. And I said, Sanjukta, we took the whole history over 45 minutes to 1 hour. What happened to you before the cancer started? What happened to you before your illness started? The question that was always used in ancient medical wisdom. Ladies and gentlemen, when were you last well? What is your wellness before your illness? And that's the key. When were you last well? And when you identify the factors of your wellness and what's gone wrong with your wellness, that makes you ill. I think that is a very, very important aspect of medical practice. And I asked her and I examined her the traditional way. You look at the face, the chest, you hold the hands, they are moist, sweaty, dry, nails, conjunctiva, throat, chest, and I examined her abdomen, and she had ovarian cancer. And she smiled at me. So I asked her, I said, Sanjukta, why are you smiling? So she says, my oncologist never examined my abdomen in the last 8 months. 8 months. She sits in a swanky office in Mumbai in a big super specialty hospital with 3 to 4 assistants around her, only looking in the tumor markers. So that is today what I bring to you, that the concept of the family doctor is very, very important. So we start my presentation, mistletoe, the kiss of life. My dear friends, life is short. Break the rules. Forgive quickly. Kiss slowly. Love truly. Laugh uncontrollably and never regret anything that makes you smile. A bit of history on this wonderful plant. According to custom, if a woman is caught standing under the mistletoe, as we all know, a man may kiss her. For centuries, mistletoe has been considered a plant that increases life and fertility. And by the 17th century, people believed a kiss beneath it could mend a broken heart. The ancient Druids in Celtic cultures believed mistletoe to be a sacred plant, and it was used in many of their rituals. They thought that mistletoe had mystical powers and held the soul of the host tree. They hung the mistletoe over doorways to ward off evil spirits during winter solstice festivities. It's also considered a symbol of life, because even when its host is leafless, it's evergreen and bears fruit in winter. The word mistletoe comes from, and is thought to stem from, the Saxon word mistle, meaning different, and twig, meaning tan, mistletoe, different twig. In ancient Scandinavia, mistletoe was known to be a plant of peace. And if two enemies came across one another in a forest with mistletoe, they had to lay down their arms and declare truce. So this is the main person who discovered mistletoe, and this was 100 years ago. So mistletoe has been used in medical treatment in Europe for various other diseases beside cancer since 600 years, for dysmenorrhea, for arthritis, for low blood pressure, etc. And 100 years ago, in 1917, in a small village in Switzerland near Arlesheim, Rudolf Steiner began using mistletoe, and he found very uniquely similarities between the mistletoe and cancer, between the appearance of mistletoe and cancer, which is so beautiful, which I'll take you through. And the first injections were administered 100 years ago. So you are looking at a therapy which is 100 years. In 1963, they opened the doors of the Lucas Clinic, which is the naturopathic clinic in Arlesheim, where I did my training, and a very, very quiet place and a beautiful center for cancer treatment, wherein they use various other anthroposophical methods, including mistletoe therapy. So what is the similarity? Let's go through the basic similarity of the appearance of the plant and cancer. It's a half parasitic plant, and it belongs to the family Loranthaceae. It grows on host trees, as we all know: oak, pine, apple, fir, elm, and others. So here you see the bunches of mistletoe growing on the host tree in a plantation in Switzerland. Are you able to see the bunches of those mistletoe growths? Another similarity between the tumor and the appearance of the mistletoe as it grows on a host tree: the density of the tumor and the density of the leaves of mistletoe. On the right side, you see the red tumor cells, the tumor clones. The groups of tumor cells are the metastasis. And as mistletoe grows on the host tree in different bunches, in different areas, from center to periphery, it's similarity to metastatic growth of a cancer. Autonomy. Mistletoe emancipates itself from the normal biological rhythms in nature to which other plants are subjected, and thereby asserts its autonomy just like a malignant tumor. As we know, it's a half-parasitic plant. A parasite normally lives at the cost of the host tree and often damages it, like cancer in the human body. Such is not the case with mistletoe. The branches of the host tree, which are seized by the mistletoe, in many cases are sustained longer than the other branches. Indefinite growth, as we all know, cancer cells proliferate, multiply indefinitely. Again, a similarity of indefinite growth of the mistletoe and cancer. So it has an inherent tendency to indefinite growth and proliferation in its leaves, flowers, and berries. In fact, if you see the picture, the different directions when a cancer grows, the different directions of the tumor, and you see the leaves that are growing in different directions, and even the upper and lower surfaces of the leaves are undifferentiated, like an undifferentiated carcinoma. In fact, mistletoe grows on the host tree at sites which have a protuberance, and it helps to devour these tumor-like protuberances. We all know a lump, a nodule, a node, just like a lump, like a tumor. So it helps to devour the tumor-like protuberances which occur on the host tree. So when Steiner saw the similarity, he thought, why not use this plant for a disease like cancer? So mistletoe and cancer treatment, mistletoe preparations are basically made of fermented aqueous extracts of freshly harvested white-berried mistletoe grown on different host trees. The mistletoe products are named according to the type of the host tree on which it grows. We won't go into the pharmacology in detail of the plant. It's a very detailed subject, but the basic components, the basic pharmacological components are lectins, viscotoxins, polysaccharides, oligosaccharides, and alkaloids. Something about lectins. Lectins are glycoproteins derived from various plants and animals with a specific sugar binding capacity. They are often of non-immune origin, but of great interest because of their ability to recognize carbohydrate components on cell membrane molecules which are important in cell recognition. And this is important with regards to cellular differentiation and neoplastic transformation. So this slide shows you the entire immunological potential of mistletoe. And if you look at the slide very carefully, I'm going to give a few seconds over here. So you have the main components, viscotoxins, oligosaccharides, polysaccharides, and you have the arrows which show. So let's start with the first arrow which goes down. It helps in stabilizing the DNA, giving an immune protective effect to patients who undergo chemotherapy. As we all know, mistletoe is widely taken to reduce the side effects of chemotherapy. Second is neuroendocrine effects, which help in the quality of life. Third, it is also cytotoxic because it kills cancer cells by a beautiful process, what is called as apoptosis, which is programmed cell death. And I presented a paper in Germany in 2018 where I was speaking on this beautiful subject of how cancer cells are identified, selected, and then devoured by macrophages under the influence of mistletoe. Unfortunately, because of lack of time, we can't go into the whole cell death process. And then you have the potential of immunomodulation. And you see B cells, T cells, granulocytes, NK cells, macrophages. In fact, it is the only molecule which has an immunogenic as well as a cytostatic potential in cancer treatment and improving the quality of life. I had a case of a nasopharyngeal carcinoma of a patient who came to me and he had bleeding. He had epistaxis from the nose. And he was given mistletoe locally into the nasopharynx, the big tumor, along with homeopathy, a remedy in homeopathy which we use for arresting bleeding in cancer patients is made from the rattlesnake. The remedy is called Crotalus horridus. So much of my protocol of treating cancer patients would be, number one, as always, going on the healing journey, identifying the constitution of the patient, which represents the psychoneuroendocrine axis, homeopathy, mistletoe, and other integrative oncology modalities. Let's continue. Mode of action, as you know, I've told you already. Immunomodulatory effects, apoptosis, reduction of side effects. So it has a DNA stabilizing effect in the peripheral blood mononuclear cells, resulting in significant protection for immunosuppressive effects of chemotherapy. And anti-angiogenesis. And of course, salutogenesis. Now this is very, very important. Before I came to West Palm Beach, I had a case, Anne, of a lady of advanced liver cancer with ascites, very anemic, lying down in bed. And I was called for a visit. And I love visiting my patients in Mumbai because that's where you really see how a patient lives, in what atmosphere, in what surroundings a patient is inhabited. So I went on the visit, and the son welcomed me, and the whole family was there. And she couldn't get up from the bed, and she had discomfort. But the pain, the overall appearance of the lady, though she was highly anemic, the way she spoke, and the son mentioned a very beautiful word, and that encompassed the whole aspect of what the family seeks when you have a cancer patient. And he said that, Doc, my aunt is deriving a lot of support from giving mistletoe. When we give the mistletoe, I see that she is more active, she communicates with the family, and she even momentarily smiles. So the injection is given every alternate day. So on the day he gives the injection, they can see a change, and he used the word support. He used the word support. So support is the fifth S in my theory of the three S's, which again we'll try and cover today. This was the subject that I presented in 2019 at the conference on Truth About Cancer in Anaheim. Let's continue. So here you see all the immunomodulatory cytotoxic effects, immunoprotection, and the neurocrine endocrine effects of mistletoe, including release of beta endorphins, better quality of life, reduction of tumor-related pain, immune function, and survival. We'll give a few seconds so you can see. So the summary of the mistletoe is the full mistletoe plant extract acts as the two red words biological whole, having both immunostimulant as well as cytostatic properties. Did you know that mistletoe was used and doctors from the Lucas Clinic were called to treat children who were subjected to widespread radiation and who were living in the villages around the Chernobyl radiation plant. And they had developed recurrent respiratory infections, recurrent pneumonias, and they were on a series of antibiotics. And they would take the antibiotic, be better for a few weeks, again relapse, again an infection, again a fever, and they were given Iscador. And this is a small study I wanted to present. So 92 children between the age group with recurrent respiratory infections were treated with mistletoe preparations, and the frequency of the recurrent respiratory infection relapses significantly came down by 78%. So you can imagine that even when the immune system is blasted by radiation, the support that the immune system derives with mistletoe. You shouldn't fall from this. So again, the indications of mistletoe in oncology, as we all know, most of the patients that come to us, they come to us with stage 3, stage 4 cancer, and the main use that we have is of palliation. Then you have adjuvant therapy, prevention of relapse after surgery, supportive therapy to reduce the side effects of chemotherapy and radiation, and prophylaxis. So a bit about the mode of administration of mistletoe, how it is administered. So basically, this is very important over here, that you have to follow the anthroposophical principles of administering mistletoe, and it's a very, very gentle therapy. You have to understand this fact. So it has to be started by giving a subcutaneous injection every alternate day, trying to understand various parameters before you start mistletoe. So as a subcutaneous injection, it's given under the skin of the abdomen into the fatty tissue, and we have basic subcute sites like the abdomen, the upper thigh, and the triceps area. So this is a small picture of helixor injections. Each box of mistletoe contains 7 ampules, and they are numbered with a rising rhythmical frequency. Now, those of you who have taken mistletoe know about the very famous local reaction. So normally when you inject mistletoe subcutaneously, what do you expect? How do you know it's working? So you see a small local reaction about a size of from 1 centimeter to 5 centimeters. It's red, flushing with itching, and it goes off in a few hours. That's because of the infiltration of T lymphocytes in that local area. So it is producing the inflammatory response that eventually leads to immune stimulation. So besides subcutaneous mistletoe, when you have widespread metastasis, bone metastasis, etc., we give IV mistletoe intrapleural, intraperitoneal for ascitic patients, and intratumoral as well. So patients, I saw a case by my very good friend when I was in the Filder Clinic in Stuttgart, Germany, Dr. Boris Müller-Hubenthal, and there was a case of an esophageal cancer, a whole growth that was blocking the esophagus, and we did an endoscopy and we injected mistletoe intratumoral, and it led to necrosis, and the patient brought out the tumor. In fact, I just remembered we had a few doctors who had come down from South America, Peru in 2014, and that was the first meeting held by Helixor. It was called as the IMM meeting till 2018, and the doctor over there presented a beautiful case of a patient who comes to ER with a huge symptom of gasping for breath, and he has a history of bronchogenic carcinoma, and they were trying to revive him and trying to resuscitate him, and there was this young dynamic doctor who had come from Peru, and he presented this case, and he took up the challenge that while they were reviving the patient, he told the family that, look, do you want to do an intratumoral mistletoe installation? So he did an intratumoral mistletoe installation in that case of bronchogenic carcinoma, and the patient coughed out the tumor, and he showed us. Amazing. I just remember, and this was way back in 2014, it used to be called as the IMM, Integrated Medicine Meetings, which were organized by Helixor, a lovely time in southern Germany, lovely area, and meeting different doctors all around the world. So the dosage basically consists of an induction therapy wherein you stepwise dose increase, start with a lower dose, and when you reach the individual reaction dose or the optimum dose, and that dose is seen as the local reaction. And then after you cross the induction therapy phase, you go on to maintenance therapy, and then you continue with that therapy as the maintenance therapy, evaluating the patient in all ways, including the general condition of the patient. Is very, very important. How a patient walks into your clinic, how a patient talks, how a patient expresses. It's not just the report. It's not just the report. And when we teach the art of medicine in the university in Mumbai to medical students who are in their final year, it is this precise art. And this art goes back 100 years, my dear friends, to a quote which I was sharing with patients over the last 2 days, and the quote is a beautiful quote by Sir William Osler, 100 years ago. And it goes like this. It's not important to know what kind of disease is there in a patient. It's more important to know what kind of patient has the disease. And to know what kind of patient has the disease, you need to sit down with your patient. You need to talk to your patient. You need to have a cup of coffee. You need to have a cup of tea. In fact, at the medical university, when young students take the initial history of the patient, I always joke in the OPD that take the patient to the cafe, give him a glass of water, some coffee, some biscuits, make the patient comfortable, and then let him unfold the story of life. And that's what led me to Healing Journeys. And that's how, when I presented Healing Journeys at the IMM in 2014, I met Dr. Nesha Winters, and that was our association and a close friendship. Let's not waste time, otherwise I'll keep on digressing. So the duration of treatment is based on all these factors, as you see, and the patient's general condition and status of the immune system. Normally, after a series of 14 injections, we give a gap of 7 to 14 days to let the immune system revive itself, recover, and stabilize. But in cases of widespread metastasis, we give mistletoe continuously till we find the patient has stabilized, and then we give the interval. In the third year, if the patient is in remission, after a detailed examination of the patient and evaluation of the immune system, the interval between the series of injections is increased to 2 weeks, 4 weeks, 8 weeks, and so on. So we have Benefits of mistletoe therapy: improvement in quality of life, inhibition of tumor growth, improvement in parameter of the immune system, tolerance to chemotherapy and radiation, prevention of relapses, metastasis, and overall improvement in the survival of cancer patients and better palliative care. So you see, it helps the patient in an overall way, and that is very, very important. This is just a basic slide on integrative oncology, a patient-centered, evidence-informed field of cancer care that utilizes mind-body practices, natural products, and/or lifestyle modifications from different traditions alongside conventional cancer treatments. As we all know, it aims to optimize health, quality of life, clinical outcomes across the cancer care continuum, and to empower people to prevent cancer and become active participants before, during, and cancer treatments. And because of the overall effects mistletoe has, in my protocol, which we use along with mistletoe, homeopathy, B17, curcumin, mistletoe stands as the main pillar in the integrative oncology protocol. And I was fortunate in 2009 to have been invited at Memorial Sloan Kettering to be a clinical observer, wherein I shared my experiences on mistletoe and homeopathy with the palliative care department, and we used to go on rounds, and it was a beautiful experience. In 2013, I consider it my privilege and honor to have presented a paper at Johns Hopkins University, wherein I spoke about thought patterns in cancer patients before the tumor develops. So what is your healing journey? What are your thought patterns before the tumor develops? The tumor is the end stage of the disease. There is something happening in your life before the actual tissue change, before the actual multiplication of cells happens. So your doc has to understand that. Again, this is a very beautiful slide wherein you have the patient and the cancer organism in the center. On the right side, you have the conventional therapies. You have surgery, chemotherapy, radiation, hormonal therapy, which lead to a direct cancer inhibition and intervention in the pathogenesis of the case. On the left side, you have mistletoe, psycho-oncology. We spoke about diet, exercise, lifestyle, which leads to, again, that beautiful word, restoring wellness and health, salutogenesis. So this is what happens in the mind of a cancer patient that comes, and you are undergoing a healing journey with the patient. He needs help. He seeks support, advice, guidance, assistance, and information. But how do you give all this until you don't sit down with the patient? So when we have sessions at my clinic, not only for a cancer patient, for any patient, the healing journey is the crux of your treatment. It's 1 hour, 1.5 hours. I've got a few case records, and I would like to show you of a normal case record that we use at our center in Mumbai, wherein you ask the past history, the sleep patterns, the dreams, what food you eat, how do you eat your food. In today's world, we all have, in big corporate offices, you have power lunches, e-lunches, you have a device going on and you're eating your food. So this is a cancer patient who is facing a maze. Where do I go? Do I go on the left? Do I take conventional treatment? Do I go on the right? Take natural healing methods? Again, a very important concept. I have only kept one slide on the seed and soil hypothesis. It states that tumor cells will metastasize to a site where the local microenvironment is favorable, just like a seed will grow if it lands on fertile soil. Paget observed that each cancer's behavior and progression depended on the condition of the whole person, and not solely on the aberrant cells. Today's researchers refer to Paget's seed cells as progenitor cells or metastatic clones, and his soil concept refers to the tumor microenvironment. And as we all know, as I have said, the concept of cellularity and cancer, as we all know, I won't spend too much time on this slide. As we all know that the basic approach in cancer treatment is local. It's a loco-regional concept. Let's go ahead. Chemotherapy and radiation. Now here is very, very important. I saw a patient who was in a big hospital in North Mumbai, and the patient had leukemia, acute myeloid leukemia. And when I took the history of the patient, they wanted to start homeopathy in the hospital because she had developed a severe swelling in her right upper limb due to a blockage, due to a clot. And when we took the history, the patient had breast cancer 6 years ago. She was given intensive chemotherapy. Some of the chemotherapy are also carcinogenic. In fact, immunosuppressive treatments in recipients of organ transplant raise the incidence of cancer manyfold. And she was given homeopathic remedies. She was given a homeopathic remedy to dissolve the clot made from the venom of a Brazilian snake called Bothrops lanceolatus. And we use a lot of venoms as a homeopathic remedy for stroke patients. In fact, my mother had a stroke last year, and we cured her with the same remedy and the venom of the Bothrops snake. Let's continue. So we all know about the holistic concept. It's very important to understand the word equilibrium. So there is a dynamic equilibrium that is normally maintained in the organism between the cells that multiply and differentiate and the controlling mechanism of the whole being, which maintains this unlimited growth within normal parameters. It is when this equilibrium breaks down that cancer develops. And mistletoe, via its action at a holistic level, restores that equilibrium. That's why it helps the patient in an overall way. So we know that. A cancer cure cannot be effected by local measures alone. Too much importance is given to the loco-regional concept to achieve destruction of cancer cells. In 1958, there was a statement: the malignant tumor has been given excessive one-sided attention, and the opposite number, the human organism, with its defensive powers, has been totally neglected. That is how the whole concept of integrative oncology came up. So what is human-centered medicine? True meaning of holistic is to take the body and the organism, anatomy and physiology as a whole. It should make you understand when you have cancer and when cancer has you. You need to focus less on what you have and more on what you are. Thank you. Oops. Let's see what's wrong over here. Okay. 1920s. Ellie Jones had mentioned, do not get so taken up by the cancerous condition that you forget the most essential part of your treatment, the general condition of the patient. And now we come to, how much time do we have, Anne? Oh, sorry? Cool, okay. So when you sit down with the patient and the patient fills the case record, you undergo the healing journey, that's where you understand what is the cancer psyche. Again, the most beautiful question in medical science. And if your doctor asks you this question, you are sure that he is the doc. And the question is, when were you last well? What is your wellness quotient? We have the emotional quotient and we have the intelligent quotient, but what is your wellness quotient before you actually fall sick? That's where you find out the root cause of the disease. So I take you back 18 years in a small suburb outside Mumbai, about 4 hours from Mumbai, and I saw a lady with severe ascites, a widespread metastatic breast cancer. And she came to me with all the reports, and her sister and the patient had come, and they sat down, and as always, these are the reports, Dr. Zubin, these are the reports. I said, I don't want to see your reports. I want to hear your story. So she's quiet. The sister is quiet. She is quiet. I am quiet. We offer a glass of water, a cup of tea. She puts her head down, continues to be quiet. This particular aspect of case taking, when you evaluate a patient who is quiet, is basically a shared silence. The concept Anne is called a shared silence that you share with a patient. And then I asked the patient to sit outside because I could sense there has to be some severe emotional trauma which has led to this state. So I asked her sister, I said, what was her state when she was well? What was she like? So her sister mentioned, oh, doc, she was very funny and jovial, very enthusiastic. And one fine day we were in a movie theater, and in the crowd while leaving the theater, she was molested on the breast. And since then, we could see certain changes in her psyche. And then after about 8-9 months, she actually took us along the journey. She developed her lump in the breast. And then we treated her with homeopathy remedies, which covers sexual abuse. The remedy is Ignatia. But when did we give the homeopathic remedy? And we gave her the remedy when there was irreversible tissue change, widespread metastatic breast cancer. Now, ladies and gentlemen, you come to the art and the beautiful science of homeopathy, which today WHO has said it is the most holistic medical science. It's not just small pellets that you receive. It's an understanding, and there is a remedy in homeopathy which we give called Ignatia, as I mentioned. If she was given that remedy at that time of trauma, I think she would have been much better in her condition. So emotional trauma is covered by certain homeopathic remedies, which include abuse, which include grief, post-traumatic stress disorder, PTSD, vexation, anger, etc. Because it is a homeopathic physician who understands the whole history as we go along the journey. So, the cancer psyche, this was a small case. Emotional and psychological factors influence the functioning of your neurophysiology and hence depress the immune response, like my very good friend Dr. Henning Soap had mentioned about how you feel impacts the immune system, thereby increasing susceptibility to viral infections, thereby creating conditions and a milieu in which the growth of cancer tumors and mutant cells are allowed to proceed unchecked. Typically, if you see a cancer patient, and this is a compilation after 25 years of going on healing journeys of cancer patients, what has happened at every stage in your life. Many a times we see a cancer patient has a severe traumatic childhood resulting from his or her relationship with parents, breakup in the family through death, divorce, prolonged separation from one or both parents. And this leads to feelings of loss, loneliness, grief, rejection, and a sort of self-hatred. So what does a patient do when at a stage in your life, at the early stages, you experience these feelings of loneliness, loss, and depression? You try to compensate and you try to please people to win their affection. If this fails, the above traits become more pronounced. And cancer patients are usually described as exceptionally fine, thoughtful, uncomplaining, and almost too good to be true. As life goes on smoothly, they are fine, but when the situation changes and they have another episode of trauma in the form of death or separation from the spouse, a conflict in relationships, loss of job, the old thought patterns all return. This engulfs the individual again in a sense of a typical cancer psyche of isolation, hopelessness, and depression. And when the disease is discovered, it's the last straw, and their despair deepens. Many times with such kind of episodes that happen during the entire cancer journey, we've seen patients succumbing in 6 months to a year, in a short time period. So a typical carcinogenic personality, we always see, number one, a lost relationship, an inability to express hostility in their own defense, feeling of unworthiness and self-dislike, and tension over the relationship of one or both parents. And at each stage, at each area of this slide, you have a homeopathic remedy which covers these states. Emotional disruption, as I mentioned, in early childhood. Most patients, in most of the histories we see, complain of a significant emotional loss up to 5 years before the onset of cancer. The sexual sphere also is important in cancers of the breast and the ovary and the cervix. Sexual and marital discord, maladjustment appear to be another major factor in the emotional makeup of cancer patients, which includes poor sexual adjustment, or dislike or aversion to sexual intercourse, failure to achieve orgasmic satisfaction during intercourse, and desertion by their partner. So this was the 3S concept which I had presented, which again we see in cancer patients, and this was my talk in 2019 for the Truth About Cancer event on the 3S's and the concept of the 3S's, which we've expanded now to the 8S concept. The first one, the first S being suppression, spontaneity, the second S and being a free spirit in life. Suppression, as we all know, is a deliberate act of trying to force the unwanted information out of our awareness, a type of motivated forgetting. Culturally, we all know it's considered stoical to hold in our more tender emotions, and not showing vulnerability is viewed typically as a sense of strength and a demonstration of character. However, the major motives in hiding our emotions are fear-based, and we are just afraid to look weak and susceptible to others. So all the factors that lead to suppression, we all know: anxiety, shock, fear, love, guilt, and humiliation. This is commonly seen in the cancer psyche. This is my favorite test. A few of my friends from the Radical Remission group know about my experience of skydiving. So spontaneity, very important. Spontaneity. You feel and you just do it. When was the last time you did something for the first time? Spontaneous thoughts, as we understand, are considered wanderings of a restless mind, and they tend to get dismissed. However, being the output of a broad category of uncontrolled and inaccessible higher order mental processes, they reveal particularly meaningful self-insight. Conversely, these random thoughts exert a great impact on judgment than do deliberate thoughts. So here is a small child seeing a football and kicking it. And the free spirit. And this is my favorite pose that I do whenever I'm very happy. I travel the world. I meet new people, and over here I'd like to express my thanks to Anne for inviting me and to share my work. So we all know the cancer journey. This is a very interesting slide on hope. EPO. Some data exists of a research protocol for a chemotherapy drug called EPO, which had marginally positive results. But one oncologist demonstrating wildly successful outcomes. Why? Rumor has it that he switched around the name of the drug protocol when he discussed it with patients. Instead of injecting his patients with EPO, he told them he's injecting them with hope. So I'll quickly take you on through the slide. I think we have about 5 to 7 more minutes. We have enough? 5 minutes? Cool. Okay, thank you, Anne. So this is a case which I saw in February 2016 of a lady with 2 daughters, and she had a blackish discharge per vaginum. On examination, there was a mass felt in the left iliac fossa, a bulky uterus. This was in Feb 2016, and she already had, when we examined her, she had bilateral supraclavicular lymph nodes. On a scan, we discovered a bilateral ovarian mass, a large solid cystic lobulated mass in the pelvis, and abutting the right and left internal iliac vessels and the right ureter. So the mass was already huge. So I still remember it was a late evening time in my clinic, and the whole family had come together to discuss there's a big mass, it's stage 4 cancer. What should we do? So it was a metastatic papillary adenocarcinoma, and the CA1 to 5 was 915. I've mentioned the patient's parameters, and she had calcified supraclavicular lymph nodes. But the patient was very, very clear. The patient says, I do not want surgery, I do not want chemotherapy, I've come only for mistletoe. And I want you to treat me with mistletoe and with homeopathy. And the family was very supportive of what she wanted. So she had a good general condition, and we began the Mali mistletoe, injection of mistletoe Mali, and she was stable in a good condition. By May, the markers reduced to 567.9, and she continued her mistletoe. She felt positive. In August, one of her distant relatives died of cancer, and this shook her up, and she went into a depression, thinking of what will happen to me, will I survive? And she was again given the homeopathic remedy at that time because she was afraid, a lot of anxiety. To cover that aspect, and mistletoe, we increased the Mali concentration to series 2, and she felt better, and the sadness and depression was lesser, and she had a good celebration with her daughters dancing and singing. November 16, she had abdominal distension, and there was ascites. Again, the marker rose to 909. At that time, we decided that because she had a peritoneal seedling causing the ascites, we will supplement subcutaneous mistletoe with IV mistletoe, with intravenous. So we gave her an IV infusion of mistletoe, Mali, 200 milligrams, and we also gave her a different type of subcute mistletoe. We changed the subcute mistletoe type. The ascites was controlled. Over here, I must mention that we have a full integrative oncology team that we work with. It took me around 16 to 18 years of my life of struggle in alternative medicine, in cancer, to show people that mistletoe works. And now, today, we have the full team in a big hospital called Breach Candy Hospital in Mumbai, wherein we have 2 surgeons, oncosurgeons, 2 oncomedical physicians, hemato-oncologists, physical therapists, psychotherapists, and myself. But it wasn't easy in those initial years. We had to really struggle and show them that this is what we do. And it is only through sheer hard work that they have come to accept the integrative aspect and the advantage of doing mistletoe in the entire cancer journey. So you see, she had developed ascites, and the markers became 700. Again in May 2017, a year later, she became depressed. She was in a low mood, and she was put on mistletoe P series 4, and she continued to receive an intraperitoneal instillation. So we tap her, and we give her the mistletoe intraperitoneal. 1 minute, I'm scared. So we continue giving her homeopathic remedies as well as mistletoe, and August 2018, March 2018, the markers remain around the 500, 600 range. And till today, she has the ascites, but she is now 7 years in stage 4 cancer. She is doing pretty well. She'd come to the clinic the other day, and there she is. Only on mistletoe and homeopathy. Thank you. Another very interesting case of a lady of invasive lobular carcinoma, and she developed a big ulcer on her hand. So she had a mastectomy done, she had lymph nodes positive, did chemotherapy, and the chemotherapy drug extravasated, and she landed up with an ulcer. So she comes to the clinic, said, "Doc," I said, "what about your cancer?" She says, no cancer. Please cure my ulcer, because that is incapacitating me. It is affecting my salutogenetic aspect of life. So we give her a homeopathic remedy from calendula. Oops. You know, we all know about calendula, right? So calendula as a local application, as an internal remedy in homeopathy. And you see the beautiful healing, which I want to show you. And there she's giving us a small sweet, a jaggery sweet at a function in Mumbai. And then we have another patient who had come to us with advanced CA ovary with a huge lymphedema of her leg, who had her main story of her life in a nutshell was that I have to work, doc. Just give me some medicine to work. She was on mistletoe and homeopathy, and she went through the last stages, and she was palliated really well. I cannot narrate the whole case because of lack of time. Another case that we saw of ovarian cancer that was operated, had a relapse, was on olaparib, and even during surgery, we attended the surgery, and she had come to us with these marker levels in June 2018. And she, in fact, very, very uniquely mentions that whenever she takes mistletoe, again, words that patients say in your follow-up are very important. She says, "And I feel very calm, doc, and I feel a sense of balance when she takes mistletoe, both intravenous as well as subcutaneous." And that's the lady she's doing absolutely normal. She comes and sees me once in 3 months, and right now she takes only IV mistletoe once a month. And it's been about 5 years now. It's another gentleman who had an amputation done due to a sarcoma, and he comes to the clinic and he takes the IV infusion, and he just sleeps. He comes 2 hours from Mumbai, from a small village. He comes, he says, "I'm very happy to come here." On one day of the month, takes the IV infusion, and he knocks off, and he's sleeping, he's snoring. You give her the remedy in homeopathy, he snores. Then he goes to his car, and I say, "Where are you going?" He says, "I'm going to my car, I'll have breakfast, then I'll have lunch, then I'll go home." Even one day, there's a difference that mistletoe makes, even in that one day, wherein he enjoys coming, he takes the IV mistletoe. Unfortunately, he passed away last year. So friends, add life to your days, not days to your life. I had a fight with my daughter, and when I put this slide, she told me, "Are you crazy? You're going to put this slide?" So this is me doing art therapy at the Filder Clinic. And they have a wonderful section wherein you go and do art therapy, and I was drawing the butterfly, and it's a very unique, I'll take around 10 seconds more. And so when I went to the Department of Art Therapy in the Filder Clinic near Stuttgart, and I told the art therapist, Christine Pomerenke, that I want to do art therapy. So she looks at me and then she looks at my designation. She says, but you are from the oncology department. So I said, yes, does that make a difference? So she says, the last few months, no one from the oncology department has come to do art therapy. I said, okay, fine. So I sit down and I draw a butterfly. My children laugh at me. I draw a butterfly. And after I finish the drawing, she comes and stands behind me. And I said, yeah, Christine. So she says, can I interpret your drawing? So then she interprets the drawing, the colors that I used, and the butterfly, which represents my desire for travel, to go to a different country each time. And it was a wonderful, wonderful moment. Thank you, Anne, once again for inviting me, and thank you all for being a very, very patient audience.
Quick question.
If there are any questions, hello.
What happens when you no longer get a response at a very high dose, say 100 of Molly, and you're no longer getting a reaction?
So many a times the local reaction is not the only way to judge mistletoe action. In fact, people, when they get an initial reaction, they are very happy, but many a times there are mistletoe antibodies which are also produced in the body after you take mistletoe for a prolonged period. But there are other parameters that you evaluate that mistletoe is still working, which includes your blood work, which includes the condition of the patient, which includes the tumor status. So even if you don't have a reaction, you have to interpret the patient's condition based on the other parameters.
Hi, my name's Jenny. Thank you for traveling for this. I've done sub-Q and IV mistletoe and sub-Q hellebores, and I am wondering if you can briefly share with us a little bit more on the indications for why you would do subtumoral.
For doing, sorry?
Why would you do subtumoral? Like, what would the indications be for a patient to do subtumoral injections as opposed to, or in addition to, sub-Q or IVs?
You mean intratumoral, by subtumoral,
yes,
intratumoral. Yes. So basically, when you find that the tumor is blocking any tubular organ, whether it's the intestine or the bronchi or the throat, you do intratumoral. But I have seen only in my journey, and I have to be extremely honest over here, intratumoral is very risky because if you by chance puncture a blood vessel, then you can have severe bleeding, and it has to be done under very, very careful supervision of an experienced mistletoe-trained oncologist. So I've only seen about 5 cases. We don't do it normally.
Thank you.
Yes, please. Yeah, so when you take, again, I go back, mistletoe is a very, very gentle drug. And on the day you do mistletoe, and I'm asked this question very often, you don't do any other therapy. Preferably one day prior and one day later, you take the mistletoe and then you carry on your other modalities. So on the day you don't do either LDN or vitamin C or other injectables. No supplements on that day when you take the mistletoe.
That I didn't know. Hi there, Dr. Marolia. Thank you so much for such an informative presentation. As somebody who does both sub-Q and IV, I took note of the intrapleural option, and pleural to me means lungs. And so would you do that for lung mets, or under what situation would you do intrapleural?
So intrapleural is done for pleural effusions, wherein the fluid, when the malignant cells infiltrate the pleural cavity. So we have our surgeons who are trained, so they drain the pleural fluid. We had a case many years ago, about 20 years ago, wherein we were able to achieve a dry tap with 3 installations of mistletoe, only mistletoe. There was no talc injected, there was no other antibiotic injected. So if you do 3 installations on an average, it is said, according to research, that you need 3.3 installations to achieve a dry pleural tap. So we do tapping, we remove the fluid, and then we inject the mistletoe intrapleural.
Okay, so it starts with fluid in the lungs
Yeah,
as opposed
fluid.
to
It's basic-
metastasis in the lungs.
Yeah, so that
Yeah.
is in the lung parenchyma. When you say pulmonary metastasis, it's not the pleural cavity, it's the parenchyma or the tissue of the lung. For that, we do IV mistletoe.
Okay, thank you.
Thank you, Dr. Marolia. Follow-up question about the intratumoral mistletoe. Could you just speak about the efficacy and an experience you have on intratumoral injection of non-resectable cutaneous SCCs, where you've got the tumors just staring you right in the face? I would think that would be a bit easier.
Again, sir, I have seen very few cases, much as intratumoral sounds to be very, very dramatic. I have not done an intratumoral injection in the last about 5 to 6 years. The ones that I saw, the only 2 cases that I saw, one was by an oncologist in the Filder Clinic, Dr. Boris Mueller-Hubenthal, who did it for the esophagus cancer, and the second one by the Peruvian doctor for bronchogenic cancer. So I am very, very hesitant. So I have no research or data to share on intratumoral. Maybe we need more research and more data. And there is a doctor in Berlin who had presented his work from a hospital on the outskirts of Berlin called Havelher. And his name is Dr. Harald Matthias. And he has done a few more intratumoral, but I don't have data from my work to share with you. Thank you. Yes, please. Yes.
Hi.
Hi.
My name is Patricia. I wanted to say thank you. I had no idea that I would walk in here today and have someone tell me, don't let cancer take over you. You take over your cancer. So thank you.
Woo!
I also have a question. So I've been metastatic breast cancer for 7 years, and I'm on hormonal therapy and NED, so it has been working. But does this work with my hormonal therapy?
Yes, yes, definitely. It will work along with the hormonal therapy.
Okay.
Mistletoe, we use it as an integrative aspect to whatever therapies you are doing. So you can continue your hormonal therapy and take mistletoe, yes?
Perfect. Thank you.
Thank you.
Hello, doctor. Thank you. Where does one get mistletoe therapy? How does someone here in the United States obtain that?
Well, there are various doctors naturopathic physicians who do mistletoe therapy in the United States. My very good friend, Dr. Nesha Winters, does it. There's a doctor from the Anthroposophical Society, Stephen Johnson, who does it. And of course, Dr. Mark Hancock from Humanizing Medicine, who has been doing work in the United States and treating patients with mistletoe. But I do virtual consults. We try and help patients with mistletoe. So even from India, we take the whole history of the patient. So I can help you if you wish to seek an online consult. But if you wish to seek a personal consult, then these 3 people would definitely help you. And you can source the mistletoe from a pharmacy in Wisconsin called Uriel Pharmacy. So Uriel, U-R-I-E-L, Uriel Pharmacy. Or you can get the mistletoe from a pharmacy in Germany. So I have the contact details. I'll share them with you, ma'am. Thank you. Yes?
Hello, hi, good morning, and
Good morning.
thank you very much for all these information that you gave us and for coming to help us understand more about the mistletoe. Just a question on the prevention of recurrence. Is this a good tool to add to prevent recurrence? And if yes, is it going to be a lifelong sort of treatment, or you take a break and then you resume again? And is it safe for long-term use for prevention of recurrence?
So if
Thank
you
you.
are, yeah, so if you are stage 1 disease and you have got operated and you normally take mistletoe for about a year, you take it alternate days for the first 6 months and then you taper off, you increase the interval between the 2 series of mistletoe and you take it for a period of about 2 years. So if you are stage 2, stage 3, then you continue it for a longer period and you do not give intervals in between. But it all depends on the entire journey to understand when you give the mistletoe. So on an average, you would take it for about 2 to 3 years to help your immune system be at an optimum level to optimize the immune system. Of course, with your diet, with a balanced lifestyle, and with meditation and other techniques that will bring you a sense of calm, like I mentioned, and the 3 S's: suppression, spontaneity, and the free spirit. Yes, please.
Thank you very much. I was wondering how I could get trained. I'm a physician and I have a wellness center here. And is there anyone I can train that implement this into my practice?
Well, if you want to be trained, ma'am, you have to do an English-speaking anthroposophical seminar in Switzerland. They have these seminars twice a year. Many are German-speaking, but they have an English section wherein they have doctors who come and speak and they share their experiences. So you can do the anthroposophical seminar and then understand the basic principles of anthroposophy. And then I'm sure that you can embark upon the journey. And if I'm able to share my knowledge and experience to guide you along the journey, you're most free to contact me. Thank you. Thank you. Yeah, Julia.
You are so lovely. Oh my gosh. So impressed. So impressed by your lecture, but also I know in the Indian culture it's very much like the Italians, and that we just love being around people, and we just love life. And so you are a people person, you love life, you exude just this amazing spirit. And I want you to know I was so impressed by meeting you, and you really moved me with our conversations and this presentation. So thank you for traveling so far.
My
I know it
pleasure.
was
My
a
pleasure. I
huge
enjoyed being here. Thank you, Anne. Thank you, Anne, for inviting me once again. Thank you very much for patient
We know
hearing.
it was a huge effort and expense, and we really appreciate having you here. I have a question. Are there any colleagues elsewhere, other doctors that you collaborate with that are doing mistletoe in the U.S. or in Europe?
Well, with Dr. Nesha Winters is one person that I've worked with. I have had the opportunity of interacting with her. In fact, I was staying with her in 2015 in Durango. It was a beautiful time, and we drove up to the Moles Pass and the Coal Pass, and so I worked with her. And I think this is a very important point, Julia, that you make. We have interacted with the Anthroposophical Society in the United States, run by Dr. Stephen Johnson. But I think we need to take it one level further for me to interact at a much more deeper level in mistletoe research and also in the entire cancer journey of a patient. So I'm open to a suggestion and to form a group wherein we share, but it has to be the traditional European system of practicing mistletoe to understand it's a very gentle drug. It has to be given subcute first. It has to be given intravenous, Julia, only according to certain principles that you have to follow. Unfortunately, it is not being done. And I see a lot of high dose being used in mistletoe, and we need to regulate that. So if I'm open to suggestions and to form a group, Julia, so if you can put me on to some doctors wherein we can do an online training or use the group, I'm willing to share my knowledge and experience.
I know Dr. Henning probably would love to explore that with you as well. So
Absolutely.
thank you so much. We really appreciate it.
Thanks very much. Yeah. There's a question.
In the goodie bag. So any closing thoughts?
No, I think we have to go back. We have to go back to the traditional art of practicing medicine and to understand when were you last well. What is your wellness quotient? And I'm sorry, I didn't see you. Sorry. And go back. Your doctor has to sit down with you for 1 hour, 1.5 hours, 2 hours. Your doc has to sit down with you and talk to you. That's what we do. That's what I enjoy being a part of the healing journey, Julia. I enjoy doing that kind of work. And the reports are always secondary. It's always the clinical skill. In fact, when we teach in the medical university in homeopathy, none of the house physicians or the registrars are allowed to touch their mobile phones. There's a strict warning that your mobile devices have to be switched off for 4 hours. And it goes up to 5 hours, 6 hours in the OPD. We start at 10 a.m. and we evaluate every patient in a mind-body connection. I'll tell you a case. Sorry, and 2 minutes. We had a gentleman who came to us with a headache, and he was a gentleman supplying cash to all the ATM centers in Mumbai. And the responsibility was so huge on him. He used to supply thousands of rupees every day and distributing money to various ATM centers. So you can imagine the responsibility when he enters his office. And he goes to a physician, he goes to a cardiologist, he's got high blood pressure. That doc spends 3 minutes with him, Julia, 3 minutes. So you got high blood pressure, take this drug, vitamin, this, tuck, go. He comes to us at the medical university. We sit down with him and we understand. I said, what are you going through? What is wrong in your life? And he says, doc, when I go to the office in the morning, I have a huge weight on my head of distributing money. You can imagine. And so that was understood, and we gave him a homeopathic remedy, and he's a changed person. He feels much lighter. He's doing very well now.
Well, we can't wait to hear you again and have you back. So thank you so
There's a question, one last question.
Sorry, last question. Do you have any thoughts of the host tree that mistletoe grows on? Is there a difference in potency of mistletoe growing on pine versus oak versus any thoughts on that?
So normally when you have an advanced cancer and the immunity is low, we use the Arbiatus mistletoe for a gentle immune stimulating effect. If you want a more potent effect in younger patients with advanced cancers, for more immunogenicity, we use the pine mistletoe, and Mali, the apple mistletoe, is in the center. So it's a very moderate immunostimulatory agent. Thank you. Thank you once again, and I won't delay you.
We really appreciate it. Thank you. I want to mention